Hello, my name is Keelan McLaverty. I'm a consultant obstetrician at BHRUT Trust. I'll be joined by one of our anaesthetists and one of our midwives to talk to you today about what to expect if you have to have an emergency caesarean section. This is when a caesarean section is unplanned. The degree of urgency will vary greatly depending on the reason for needing the caesarean section. 1 in 4 births in the United Kingdom now are via caesarean, and 2/3 of these are unplanned. Therefore, we would advise everyone to watch this video even if a C-section is not what you're expecting to have yourself. We believe that by being well prepared and well informed, even this unexpected type of delivery can be a positive experience. The timing of when the caesarean will happen will vary very much dependent on each individual circumstance and will be discussed with you by the team at the time. Sometimes it may be a matter of hours between decision and delivery, and sometimes the caesarean may have to happen very quickly within the next 30 minutes or so. This is known as a Category 1 caesarean section. It means that everything must move very quickly to get you to the operating theatre and to get the baby delivered safely. Therefore, a buzzer is often pulled in your room, which will summon a lot of people to the room, and this can feel very overwhelming. The most important thing to remember is that everyone is there to help you and your baby to achieve a safe delivery.
Depending on how quickly the emergency caesarean section needs to happen, your obstetrician and the anaesthetist may decide that there is time to administer a spinal injection so you'll be awake for when your baby arrives. Or you may already have an epidural in place, which can be used instead of a spinal injection, and you'll be given extra medications through the epidural to make your tummy and legs numb, ready for surgery. If you have a regional anaesthetic, your birth partner will be able to join you in the arrival of your baby. Depending on multiple factors, some of these options may not be possible, and you will have a general anaesthetic where you will be put to sleep, using both injected and inhaled drugs to make sure you're pain-free during the surgery. This will allow the caesarean section to happen more quickly, but you will not be awake during the procedure, and unfortunately your birth partner will not be present for the arrival of the baby. If you have a general anaesthetic, you will have monitoring applied to check on your heart rate, blood pressure and oxygen levels. You will be given a liquid to drink before you go to sleep, which will neutralise any acid in your stomach. You will have an oxygen mask placed over your face, and the anaesthetic medications will be placed in a drip which will be in your arm. You will be asleep within 10 seconds, and at this point the surgery will be able to begin. If alternatively you have a spinal anaesthetic and will therefore stay awake for the operation, a cold cleaning solution will be sprayed onto your back and then local anaesthetic injected to numb the area. After this, you should just feel pressure and pushing in your back. If you feel tingling, it is nothing to worry about, but please tell the anaesthetist. It may take several minutes for the spinal anaesthetic to be placed and may be attempted on more than one place on your back. Once the spinal is in, you will feel that your bottom and legs may become heavy and warm. The sensation in your tummy will change, and this can take around 5 to 10 minutes or sometimes longer. Whilst waiting for the spinal anaesthetic to take full effect, your midwife will ask for your consent to insert a catheter into your bladder. You will not be able to feel this. After this, you will receive an antibiotic prior to surgery to prevent wound infections. Your blood pressure may fall after the spinal anaesthetic is inserted, and you can feel sick. This is easily treated by giving you a medicine into the drip in your arm to bring your blood pressure back up, and this will take away the sickness feeling. Your anaesthetist will check they are happy with the block using a cold spray, and once they are happy, the surgery can then begin. During the operation, you will still be able to feel pulling and pressure, but you should not feel any sharp pain. If you are uncomfortable, let the anaesthetist know and they can give you more pain relief or, in some instances, a general anaesthetic. Once the baby arrives, it may be possible for skin to skin if all is well, or as soon as it is possible. Sometimes the baby can need extra checks by the paediatric team or the midwife. After the baby is delivered, you will receive medicine to help the womb to contract, as well as pain relief through the drip.
After the operation, you will be moved to the recovery area and have routine monitoring for about 30 minutes. Here, you will be able to drink and may be able to eat. The midwives will be able to help you with feeding your baby, whether it be the breast or the bottle. Once the nursing team are happy that your pain relief and general observations are within the normal range, they will transfer you to the postnatal ward. You should have sensation return to your legs within a few hours. We encourage you to get out of bed as soon as you feel ready. Once the drip and catheter are removed and you're comfortable on your painkillers, you can start the plan to go home. The nursing staff and medical team will arrange for iron medication, blood thinning medication if these are necessary. What is also important for you to know is that your stitches will take at least 14 days to heal. Sometimes they may need to be taken out, but majority of the times they dissolve amongst themselves. It's also important that you move around, though in a limited capacity, because movement is always good, and take pain relief as you need it to ensure that you can still carry on with caring for your baby.